My name is Wolfgang Goetz. I am cardiac surgeon and CEO of Transcatheter Technologies that is developing the next generation transcatheter aortic heart valve prosthesis. Aortic valve stenosis is the most common acquired heart valve disease that affects about 5% of the population older than 75 years. 30% of these patients cannot be treated with surgical valve replacement because they are too fragile and have too many comorbidities that make open heart surgery for them impossible. For these patients, transcatheter aortic heart valve implantation was invented. The valve prosthesis is implanted via catheter into the beating heart without open heart surgery. This makes new valve implantation safer for these patients with a lower mortality, a shorter recovery time, and no need for rehabilitation. Despite this huge success of this new therapy, the clinicians demand a safer device that is repositionable and retrievable, that is better sealing and is longer durable. Transcatheter Technologies has developed a novel aortic heart valve prosthesis Trinity that will solve these problems of already existing devices on the market. Trinity is easier to implant, is safer and has a longer durability. The Trinity valve prosthesis consists of biological leaflets in a self-expanding frame. The valve is mounted on a catheter that is inserted via the apex of the heart. The preparation for implantation is easier and faster because the valve is already pre-mounted on a detachable catheter tip that is just connected to the handle in the operating room before implantation. This will save expensive operation room time and will eliminate a technician who is needed to mount the valve right before implantation. The valve leaflets of Trinity are protected in a kind of a garage. When the valve is folded onto the catheter, preventing damage to the fragile leaflets. This is mandatory for increasing the durability of the valve prosthesis. The Trinity catheter is inserted over the apex of the heart. When the sheath is retracted, the valve remains folded here on the left side of the slide. Then the valve is positioned and slowly and stepwise expanded and anchored. Now, the valve function can be fully evaluated. Is the result not acceptable, the valve can be refolded here on the left and repositioned. If the result is acceptable, the valve is released here on the right. It is important that there is no more change in geometry when the valve is released. The valve remains exactly the same like when it was evaluated. This makes valve implantation more predictable and safer. To prevent paravalvular leakage, we have developed a unique C-shaped wave crown with webbed fingers. These small webs will seal any potential paravalvular leakage and eliminates valve insufficiency. The Trinity valve prosthesis is positioned supraannually, several millimeters above the heart conduction system, reducing the risk for damaging the conduction system and the need for new pacemaker implantation.
In a transapical aortic valve procedure, first the balloon catheter is introduced via the apex of the heart, and the stenotic aortic valve is dilated. Subsequently, the Trinity catheter system is advanced, and the prosthesis is positioned and controllably expanded in the aortic root. Here, the valve has been implanted too deeply, causing paravalvular regurgitation. The valve can be refolded and repositioned several times to find the appropriate position. Once the valve is correctly positioned, the prosthesis is disconnected and the catheter retrieved, leaving an excellently functioning heart valve prosthesis in place. The Trinity valve prosthesis has a unique sealing cuff that prevents paravalvular leakage. When correctly positioned, the prosthesis does not reach into the left ventricular outflow tract, avoiding compression and damage to the heart conduction system.
In our first-in-human implants, we could prove that the valve can be safely deployed and anchored. We could achieve first-time right positioning, but we were also able to reposition the valve in order to improve our result. There was zero paravalvular leakage and no AV block or indication for new pacemaker implantation. The follow-up shows that the valve continues working perfectly. The main advantages of Trinity are increasing safety by being repositionable and retrievable, eliminating paravalvular leakage, whereas our competitors have in up to 2/3 of their implants a relevant leakage, and drastically reducing the risk for pacemaker implantation, whereas our competitors have in up to 1/3 of their implants an indication for new pacemakers. Transcatheter heart valves were developed to treat patients that cannot undergo open heart surgery. But since the technology did prove to be safe and efficient, now also healthier patients and younger patients want to have the advantage of this less invasive implantation. Transcatheter Technology's Trinity valve prosthesis is a safer system that is designed to eliminate paravalvular leakage and to have a longer lasting lifetime. This will allow for extending the indication for transcatheter valve implantation to patients with lower surgical risk.
What is a true repositionability? I think it's a very important thing. First, with this valve, you can implant it, you have a full functional result as it is now, and then see and evaluate very quietly on a stable patient with a stable hemodynamics and see whatever it is. If it is the case that you are not satisfied with the result, then you can easily crimp the valve to its small size. You can really reposition the valve a little bit up or a little bit down and open it again. So everything is very quiet, very stable, very controlled. And this is a true repositionability. It's not like the valve is half implanted, and so then you can push it up a little bit, and you risk debris from the calcified valve and everything like this. So you don't have this with this valve, and everything is very controlled. And this is a feature that I like a lot in the experience that I have with this valve. I can see only the Trinity valve that has the capability of a truly repositionability and a true functional evaluation of the valve so far. So is it still a game changer? I think concerning the repositionability, yes, it's that, and I think it's a really important issue.
Trinity is safer by being repositionable. It eliminates paravalvular leakage and reduces the risk for new pacemaker implantation. By protecting the fragile biological leaflets, it is designed to last longer. The higher safety, the elimination of paravalvular leakage, and the reduction of new pacemaker implantation, and the shortening of operation room time and persons needed for having the valve prosthesis mounted will allow Trinity to be more cost effective compared with all the other competitors.